Book report presentation. Teresa Foster, Houston Christian University, Counseling 6341, Instructor Karen Frederick, June 26, 25. My presentation is over Dibs in Search of Self by Virginia M. Axline. Unveiling the journey that shaped him, the journey of one boy's search toward sense of self through play therapy. Introduction and summary. The story of Dibs. Dibs is a 5-year-old boy who exhibited high emotional distress, undergoing a series of play therapy sessions with a clinical psychologist at Children Guidance Center. The author. The author and practicing psychologist of the novel is Virginia M. Axline, also known as Miss A by Dibs, a clinical psychologist. Ms. Axline studied at Ohio State University and Columbia University. She served 3 years as a research associate at the University of Chicago. She is recognized for her work in play theory and practice for emotionally disturbed children. Summary. After 2 years of minimal progress, Ms. Axline was summoned by the staff at Dibs Private School to assess him and hopefully determine the cause or root of his conflicted behaviors. Their motivation to help Dibs was forged by their care for him and faith in his ability to overcome his emotional distress. Despite evidence of superior intelligence, causes of his disruptive, resistive, and violent behavior was unknown. Dibs met with Ms. Axline for 1 hour once a week every Thursday over the course of a year to participate in play therapy, including dolls, sandbox, and painting. As sessions continued, Dibs exhibited progress in the form of identifying his emotions, emotional regulation, self-expression, self-identity, communication, and self-esteem. Ultimately, Dibs improved in his ability to establish and sustain healthy relationships with his family and other children. Relevance to the work. The following slides will cover the strengths, weaknesses, and questions I identified while reading the novel. Strengths will cover the content that may be helpful to a professional counselor, such as exhibiting patience towards the child and the benefits of child-centered play therapy. Weaknesses will include the underdeveloped areas that may be helpful for a professional counselor, such as the lack of parental integration and the acknowledgement of no goals or objectives being established. Questions or information not included in the content that would be valuable to a professional counselor will also be discussed. Strengths I identified while reading the novel included patience exhibited by Ms. Axline as the clinical psychologist and her effective use of child-centered play therapy. When executing patience, Ms. Axline granted Dibs a sense of control in himself and the environment and did not rush him as he chose to play and process. By allowing Dibs to take the lead in the discussion, she noted when the initiative is left up to the individual, he will select the ground upon which he feels his greatest security. When the child or client feels safe in their environment, this opens up the door for them to share more and be more vulnerable and more progressive in the therapeutic process. Ms. Axline did not push Dibs to open up, nor did she exercise excessive questions, but rather integrated positive feedback and confirmation in what he was already displaying. She provided reassurance in his behaviors and correction as needed. Dibs felt very comfortable from the beginning of the sessions. She granted him and informed him that this was his time as he can use as he see fit. Her use of child-centered play therapy. Play therapy is based on the belief that play is children's natural medium of communication and learning about themselves and the world and others in it. Due to their abstract cognitive abilities and limited verbal expression, young children uses play therapy as a concrete and nonverbal means of expression. This allows them to trust in their inner direction and capacity to act responsibly and to solve their own problems. This was exhibited through Dibs multiple times. For example, when he would turn on the faucet in the playroom, and before it overflows, he would turn it off. He learned to start putting the toys back where he found them instead of leaving them out. Child-centered play therapy also proved to improve reading and language skills, self-concept, and decreasing externalized behaviors. Dibs started to open up more, communicate more efficiently, started using pronouns such as I, and had decreased in tantrums by the time the middle of his sessions continued. By the end of the novel, he had made great progress in his behaviors and ability to sustain healthy relationships with his family and his peers and other children. Weaknesses. Weaknesses identified while reading Dibs in Search of Self included lack of parental integration and no goals or objectives being established to monitor progress. Parental integration. Parental integration and the lack thereof was initiated by Dib's mother. She stated, "And I will not be able to come in for any interviews myself. There is nothing more than I can add. My husband is not willing to come in either." From the beginning, her and her husband decided to not participate in the counseling sessions with Dibs. Their response towards Dibs can be explained by parental burnout. Parental burnout is an emotional disorder in parenting that consists of multiple symptoms that is in result of prolonged parental pressures. Parental burnout can lead to emotional and behavioral detachment from the children, such as when Dib's mother noted that she and her husband resented Dibs. She made comments such as they were happier before Dibs was born. She remembers being ill during the entirety of her pregnancy. And since she was unable to continue her career, she experienced a sense of loss of identity. Parental burnout can also lead to the neglect of the child's fundamental needs. Dibs was described by other psychiatrists as being rejected and emotionally deprived. Also, parental burnout can lead to the inability of the parents to connect with their child. Dib's mother noted when he would cry as a child, she was unable to console him. And no matter how many items her and her husband bought to appease Dibs, he seemed to be more isolated and and dissatisfied. Despite Chris's emphasis on the importance of parental involvement in the counseling process. Miss Axon did not encourage Dib's parents to be involved. She respected their decision to stay away from the process. However, Kress tells us that the adults' involvement to teach and educate them on managing adverse behaviors can lead to positive counseling experiences and progress for the child. Also, no goals were established to monitor the improvements. Due to the lack of parental integration, it does not appear any goals were established for the sessions with Dibs. Ms. Axline did not identify objectives or goals, except for the sole purpose of allowing Dibs to have a safe space to express himself and come into a sense of self. Nor did she communicate with the teachers. The lack of communication with the teachers at his school showed that there was no communication on whether or not Dibs was exhibiting progress outside of the sessions. It is imperative that clients take what they learn in session into the outside world. Ms. Axland gained all her information based off of in her sessions with Dibs in the counseling setting. I believe it would have been more beneficial for her as a psychologist working with Dibs to know if he was making progress outside the sessions in his home and in his school, where he has exhibited the most adverse behavioral effect. Questions that occurred to me while reading Dibs in Search of Self included: why didn't Miss Axland invite Dibs' parents to view from the double-sided mirror? In the playroom, there was a double-sided mirror where on the other side, observers were taking notes and recording the session. I wonder if Dib's parents were invited to view him in a safe space, would it change their perspective on his diagnoses? For they assumed he was mentally disturbed or had brain damage. However, in a safe environment, he thrived and flourished very well. Second question. Should Ms. Axon reported signs of emotional abuse based on her observation of Dib's father speaking harshly towards him and the story told to her by Dib's mother? Upon Dib's father picking him up from sessions one day, he was very dismissive and cold towards Dibs as Dibs tried to speak to him and share with him about Independence Day. Also, Dib's mother came in to meet Miss Axline on one account, and she shared what happened the night before where Dib's father grew angry towards Dibs, picked him up while Dibs was having a tantrum and put him in his room and locked him in there while Dibs was screaming, "I hate you." This form of emotional neglect and slash abuse makes me question if this is grounds for reports. Also, gathering more information slash probing. Should Ms. Axline probe more into the dynamics and home life of Dibs after viewing the aggressive way he was playing and portraying his father and sister during play? On 3 different accounts, Dibs buried his father as a soldier, a toy, in the sand as a grave. The same toy soldier that portrayed his father, he knocked over multiple times. He would stand him up and knock him down. On another occasion, Dibs made volatile statements towards his sister that was almost sadistic and insidious in nature and showed a lack of remorse. Miss Axline decided to not probe on these acts of play but I wonder if she should have to gain more information on what was causing the distress between Dibs and his father and Dibs and his sister. Relevance to the course text. The next two slides will review the developmental stages of cognitive development, physical development, emotional development, and psychosocial development as described by the course text Counseling Children and Adolescents by Victoria E. Kress, and how it applies to Dibs in search of self. Cognitive development. In the course text, cognitive development for early childhood consists of preoperational stage and sensory motor stage. The preoperational stage consists of the ability to use dolls and toys for the children to act out their home life in stressful situations, and them being able to count and recite alphabet. This was implemented by Dibs as he was able to use the sandbox to build and the toy soldiers to portray his father and his sister, and paint to paint his family as well, to provide insight from Miss Axlin on the distressful situations and feelings he was having towards his family members. He would also resort to using inanimate objects during moments of feeling distressed. He would count and recite alphabet and read everything in the room as part of this stage. The sensory motor stage consists of the use of the child using their five senses to create stimulation. Dibs would touch everything in the room, and he ate the sand at one point, which showed as evidence of him being able to connect with the room and establish a sense of safety for himself while there. Physical development. The course text notes that chronic stress can lead to negative emotional effect. This is portrayed by Dibs through the resentment from his parents at his conception and birth, his parents being ashamed of him, and his parents showing favoritism for his sister, referring to her as the perfect child. Dibs was able to pick up on these negative feelings and words from his parents by overhearing them and feeling their emotions towards him and distanced from him, which could lead to his chronic stress. Emotional development. Youth at this age model what they see from their caregivers and those from whom they have an attachment bond. It is imperative for adults and caregivers to exercise healthy emotional regulation so that the child may mimic and learn from that. However, in Dib's situation, his parents showed unhealthy modeling, serving as a risk factor for Dib's ability to emotionally regulate himself. Dib's parents were described as hostile and resistive, having a lack of emotional maturity and self understanding. Dib's dad was described as being very ill at ease. Dib's mom was described as cold. And Dib's mom also noted that her and her husband prioritized intellectual ability over emotional expression. Psychosocial development, psychosocial stages. According to course texts, psychosocial development places great emphasis for early childhood on attachment bonds and the youth's ability to navigate through Erickson's psychosocial stages. Attachment bonds are defined as the youth's ability to turn to their caregivers for support and comfort. Insecure attachment bonds form when an infant's needs are not consistently met, and therefore they are left feeling unwanted, unloved, and unsafe with others. Dibs was unable to turn to his parents for comfort due to chronic stress, their lack of ability to understand him, their emotional immaturity, and initial resentment towards him. According to Erickson's psychosocial therapy, the inability to successfully transition to the next stage is in result of the youth's inability to successfully complete the current stage. For example, during times of insecurity, Dibs will revert back to infant-like behaviors that are commonly associated with autonomy versus shame and doubt. Based off of Dib's age, he is technically in the initiative versus guilt stage. But during high stress situations, he will revert back to sucking and chewing on bottle nipples, sucking on the bottle, finding comfort in pretending the sandbox is a crib, and whimpering and sounding helpless at completing tasks he knows how to do, such as tying his shoes. This conflicts with his ability to remain autonomous. And the youth can experience psychosocial difficulties in their initiatives if they're not well perceived by peers or by their parents, such as Dibs. Though he exhibited as being very creative and having some form of superior intelligence while in a safe environment, during times of insecurity, he reverted back to feeling helpless, as though an infant, where he was highly neglected and exhibited most form of his emotional trauma by his parents. Personal thoughts. While reading Dibs-In Search and Self, I gained the practical understanding of play therapy, where the child and the process of counseling is not rushed, and what it looks like when successfully completed. With the proper support system and a safe environment, children are able to thrive by turning concrete concepts into abstract ones that incite conversation and insight into their world of what is causing them stress and anger and anxiety and possible depression. For Dibs, it was a successful process. As sessions continued on, he no longer threw tantrums at home or at school. He expressed a desire wanting to play with other children. His relationships with his family improved. His mother described him as happy, relaxed, and talkative. He no longer felt the need to be coddled or suck on the bottle, which showed a sign of him successfully transitioning through Erickson's psychosocial stages. And in the epilogue, as a 15-year-old, he was described as a leader and advocate for his peers. Although I do not plan to work with children in my career, reading Dibs-In Search of Self helped me to understand the importance of emotional regulations and how where adults place their value affects their relationship with others and their family and their own progress. For example, Dib's parents place an emphasis and high value in intellectual ability. Therefore, when Dibs showed this to be a barrier, they were ashamed and embarrassed. However, their own emotional immaturity and their inability to model proper emotional regulation contributed to Dib's adverse externalized behavior. Would I refer this book to others? Yes. Whether it be for learning or entertainment purposes, counselors, readers, parents, teachers, educators, and caregivers can learn the importance on being present and the power of our presence to stimulate positive growth and change in clients and in children. That we do not have to rush to the medicine. We can just provide a safe space, allow the child to grow, to express themselves, determine within themselves who they are in relation to the environment and to others. As Div stated, as I wanted it, as you wanted it, as we wanted it. Thank you.